All right, let's just get this out of the way right now because it's a big one. There's this myth, this idea that's been floating around for decades that you can get HIV from a hug or a handshake, or God forbid, you share a Coke with someone. You see someone you know has HIV, and suddenly you're treating them like they've got laser beams shooting out of their eyes. You're doing this awkward sidestep, this little dance to avoid touching them. It's a scene straight out of a bad spy movie, but it happens every day. This fear is based on a total misunderstanding of how this virus actually operates. It's a relic from a time of panic and misinformation, and it needs to be put to rest for good. So let's state the fact loud and clear for the people in the back. You cannot, I repeat, cannot get HIV from casual everyday contact. Hugging someone with HIV, totally safe. Shaking their hand, go for it. Sharing a meal, a fork, a toilet seat, you are absolutely fine. The virus doesn't live on surfaces. It doesn't travel through the air when someone coughs. It's not passed through saliva in a friendly peck on the cheek. This isn't some super germ that can leap across a room. The way HIV is transmitted is very specific, and once you understand that, the fear starts to look pretty ridiculous. It's time we separate the science from the stigma. The reason we need to talk about this so plainly is because these myths do real harm. They create a wall of fear and isolation around people living with HIV. Stigma can stop people from getting tested, from telling partners, from seeking care. So today, we're replacing myths with real useful knowledge that can make a world of difference. So, what is this virus we're talking about? Let's break down the name itself. HIV stands for Human Immunodeficiency Virus. Human means it only affects us people. You're not going to get it from your cat or dog. Immunodeficiency is the key part. Think of your immune system as your body's personal security team, your elite squad of bouncers. They patrol your body, kicking out troublemakers like bacteria and other viruses. Virus is just the name for this tiny germ. So HIV is a virus that specifically targets and weakens your body's security team. This virus is sneaky. It doesn't just crash the party, it takes over the security headquarters. Its main target is a special type of white blood cell called a CD4 cell, the generals of your immune army. HIV turns these cells into little virus-making factories, eventually destroying them and spreading to others. Left untreated, this leads to a steady decline in your body's ability to defend itself. It's really important to understand that HIV is not the same thing as AIDS. HIV is the virus. AIDS is a late-stage condition if HIV isn't treated. AIDS is diagnosed when CD4 cells are very low or certain opportunistic infections develop. The good news with today's treatments, most people with HIV will never develop AIDS. Modern medicine can stop the virus from making copies, protecting your immune system. People can live for decades, have a normal life expectancy, and stay well. An HIV diagnosis today is a different reality than the 80s and 90s. It's a manageable chronic condition. Let's keep it simple, factual, and hopeful. The science is on our side. How does HIV actually move from one person to another? It's not magic. The virus has to travel in a vehicle and can survive only in specific ones. HIV lives in certain body fluids. The main ones to know are blood, semen, and pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk. Transmission happens when one of these fluids enters another person's bloodstream. This can occur through mucous membranes like the vagina, rectum, or the opening of the penis, or via direct injection. Globally, the number one route is sex without a condom. During vaginal sex, tiny tears can create entry points for the virus. Anal sex carries higher risk because the rectal lining is more delicate. Sharing needles is another major route. Blood in the syringe can be injected directly. From mother to child can occur in pregnancy, childbirth, or breastfeeding, yet with proper ART, risk drops to under 1%. Transfusions are now extremely safe in most places due to rigorous screening. Hugging, kissing, sharing drinks. Mosquito bites? No, absolutely not. Saliva, tears, and sweat don't contain enough virus to transmit. The virus can't survive long outside the body. No risk from toilet seats or doorknobs. Insects don't inject another person's blood when they bite. Understanding specifics is how we dismantle fear. Science over stigma, always. When someone gets HIV, the body often reacts. The signs can be tricky and change over time. We describe 3 stages: early, clinical latency, and late AIDS. The acute stage usually happens within 2 to 4 weeks after infection. Viral load is very high, so transmission risk increases. Many, but not all, feel like they have the flu. Fever, sore throat, extreme fatigue, swollen lymph nodes, rash, muscle or joint aches. Symptoms can last a few weeks, then resolve. Because signs are non-specific, the only way to know is to get tested. Next is the clinical latency stage, often the longest. The virus is active at very low levels. Many feel perfectly healthy, sometimes for a decade or more. Even without symptoms, HIV slowly chips away at CD4 cells. People can feel fine and unknowingly pass the virus if not on treatment. Without treatment, the immune system is overwhelmed. This leads to AIDS. CD4 count falls to critical levels. People become vulnerable to serious infections and some cancers. Rapid weight loss, chronic diarrhea, persistent fevers, night sweats can occur. Today, this stage is preventable with treatment. HIV sneaks past CD4 guards, inserts its code into cells, and turns them into virus factories. Over time, defenses erode. When CD4 drops below 200 cells per mm3, the system is considered compromised. This is AIDS. Treatment works because it interrupts that replication cycle. That's the why behind testing and early treatment. Since symptoms can mislead or be absent, there's only one way to know your status. You have to get tested. Testing can feel scary, but it's simple, responsible, and empowering. Today, it's easier, faster, and more private than ever. There are a few types: antibody tests, antigen antibody tests, and nucleic acid tests. Antibody tests look for your immune response. Rapid versions can give results in about 20 minutes. Remember the window period, weeks to months for antibodies to appear. Antigen IgG antibody tests detect P24 antigen earlier, often within 2 to 4 weeks. NATs look for the virus's RNA and can be positive as early as 10 days. Used for early exposure or confirmation. Any positive result is confirmed with a follow-up test. The treatment for HIV today is nothing short of a medical miracle. ART, antiretroviral therapy, controls the virus. Often it's 1 pill once a day. Different medicines block entry, reverse transcription, integration, and assembly. Taken consistently, ART reduces HIV to levels so low, standard tests can't detect it. That's called an undetectable viral load. First, it protects your immune system. CD4 counts recover and stay high. Second, undetectable equals untransmittable, U, psi U. No sexual transmission when consistently undetectable. This frees people from fear and helps end the epidemic. RT isn't a cure, but it puts you in control, enabling a long, healthy, normal life. Preventing HIV isn't about fear, it's about being smart, informed, and prepared. Condoms, used correctly and consistently, are extremely effective at blocking fluid exchange. PrEP, pre-exposure prophylaxis, is a daily pill for HIV-negative people at risk, over 99% effective for sex when taken as prescribed. It builds protective medicine levels, blocking HIV from taking hold. PEP post-exposure prophylaxis must start as soon as possible, definitely within 72 hours for 28 days. The most powerful tools remain treatment and testing. On treatment with an undetectable viral load, a person cannot transmit HIV sexually. Regular testing yourself and your partners is an act of care. An HIV diagnosis today is the start of a new chapter. With art, people live normal lifespans, careers, love, travel, children, and growing old. The hardest part is often stigma. We fight it with education, respect, and dignity. Managing HIV is a partnership: regular checkups, monitoring viral load, and CD4, plus overall health, good nutrition, regular exercise, and mental health care matter. Support groups offer community and understanding. Pregnancy on ART with newborn prophylaxis, transmission risk under 1%. Mixed status couples can conceive safely with PrEP and U equals U. From fear and no treatment to single pill regimens, PrEP, PEP, and U equals U, the progress is staggering. Global programs expanded ART access. Research advances toward long-acting meds, cures, and vaccines. Please subscribe to my channel. Thank you.